Welcome back. Breaking news into Bloomberg. Montana Democrat Max Baucus, he is the chair of the Senate Finance Committee. Senator Baucus telling reporters that a health care public option cannot pass the Senate. Baucus saying it cannot pass the Senate. He also says his panel will consider a bill even without Republican support. The comments from Max Baucus, the Montana Democrat who is chairman of the Senate Finance Committee. Well, in a little more than 7 hours, the president is going to address a joint session of Congress detailing his plans for health care reform. It's probably the most important speech of his young presidency so far, and it has the potential to lead to the biggest overhaul of health care coverage since Medicare was created more than 40 years ago. Joining us now is Cleve Killingsworth. He's chairman and CEO of Blue Cross Blue Shield of Massachusetts, the biggest insurer in the Commonwealth. Massachusetts instituted universal health care coverage in 2006 and has had to make adjustments since then. Mr. Killingsworth, welcome to Bloomberg News.
It's my great pleasure. Thank you.
Sir, what are you expecting to hear from the president tonight? What do you want to hear from the president tonight?
Well, you know, this president, more than any other, I think recognizes that more care isn't the same thing as better care. So what I hope is that he'll bring greater emphasis to this idea, and then we can begin to focus on the underlying factors that are driving the cost of care.
And what might those factors be?
Well, I think the basic healthcare system here in this country is largely driven by how many procedures and how many hospital admissions actually take place. And this has been referred to over the years as a perverse incentive. In fact, what we need to do is change the payment system so that providers are paid for the quality of care and the clinical outcomes instead of the number of services that they provide. And the president has talked about this in his speeches in the past, and I hope he'll emphasize it tonight.
In 2006, the Massachusetts plan did not address affordability, though. It is now, though. What is Massachusetts doing about these rising health care costs that perhaps can be emulated on a national scale?
Well, we've taken a couple of innovations that I think are very important, not just for us, but I think as examples for the rest of the country. For example, Blue Cross Blue Shield has introduced a new contract. It's called a global payment arrangement, or global payment contract. And under this contract, there's essentially a budget for the cost of delivering care to our members. And then there are bonuses that are associated with improving the quality of care that is provided. So this particular contract changes the incentive. Another thing that's happened in our state that's very exciting is that a state commission on payment reform, which was called for under the health reform legislation, has met and deliberated on this issue of cost and has recommended that the state move away from fee-for-service medicine completely and instead move to a global payment kind of arrangement.
But what are the doctors who are participating in this global payment system saying? Are they satisfied with their compensation?
Well, I think that there are some concern about how we get this done on a statewide basis. But you have to remember, doctors are represented in this commission, as well as hospital representatives and legislators and academic and insurers. So this was a unanimous vote by this commission. And the idea of a state commission like this voting to move away from fee-for-service to global payment is historic and very important for controlling costs as we look forward. And, of course, improving the quality of care as a consequence.
Mr. Killingsworth, we noted in some of the materials we looked at beforehand that the coverage rate in Massachusetts is 97.5%. What happens to the other 2.5%?
Well, I think the state is working to take a very careful look at who those individuals are. It may be that the best resolution for those folks who currently don't have coverage is to give them is to change the program so that more folks are covered under the subsidy program. So I think if all other kind of initiatives fail to achieve 100% coverage, we'll change the subsidy so that those folks get help in paying for their insurance.
As CEO of a major insurance company, how do you feel about a public option or a co-op? Do you agree with the president that it'll make your industry more competitive?
I think that those who support a public plan are moving from a fundamentally flawed basis. And what they say is that we need a public plan to make private insurance more competitive. Well, you know, our position is that we're willing to compete with anybody if it's a level playing field. But if a public plan doesn't have to keep reserves, doesn't have to obey state mandates, doesn't have to generate a margin, doesn't have to do all those things that we have to do, then it's not a level playing field.
Right.
And, of course, we have competitors today. So it really begs the question, you know, what's trying to be accomplished.
Yeah. And Mr. Killingsworth, we're going to have to leave it there. Cleve Killingsworth, Chairman and CEO of Blue Cross and Blue Shield of Massachusetts, joining us from Boston. Sir, thanks.
My great pleasure. Thank you.